Hello everyone, Dr. Sutter Caton, physical therapist here with Vive Health. Wanted to tell you a little bit about my background. Graduated in 2019 with my degree in physical therapy from Florida Gulf Coast University down here in Fort Myers, Florida. In 2015, I graduated from the same university with my bachelor's in exercise science, so I've always had a passion for this field. And since graduating, I've been working in the outpatient sector as well as working in home health. During schooling, I had clinical rotations in a wide variety of settings, including hospitals, skilled nursing facilities, outpatient locations, as well as working with professional athletes with the Minnesota Twins baseball team. I'm looking forward to sharing all my knowledge with you, and I hope you enjoy. So by far, the most common way to sprain your wrist is to fall on the hand and the wrist with your arm outstretched, typically with the wrist extended, but it also can happen this way. It's just a little bit less common. Another common way that you may injure it is through lifting a heavy weight or lifting a weight with improper form. And in severe cases, the patient might report or you might feel or hear an audible pop occur when you land on the hand or otherwise injure the wrist. So the wrist consists of 8 different carpal bones as well as the forearm. There's a large number of ligaments that attach these bones to one another as well as to the forearm. So when a sprain occurs, there's a large amount of ligaments that can be involved in the sprain. What a sprain really is just when a ligament is overstretched past its capacity, and that's when a sprain occurs, and we typically grade them 1 through 3. So a grade 1 sprain occurs when that ligament is overstretched, but there's no rupture or tearing of the ligament. So in those cases, there's no joint instability. In a grade 2 tear, there's going to be a partial rupture of that ligament, and there's going to be possibly some minor joint instability taking place. A grade 3 tear is going to be a full tear of that ligament, and there's going to be a large amount of excess joint play or instability, as we call it, present in the joint. So unless there is a traumatic event that you can pinpoint, it can be pretty difficult to self-diagnose yourself with a wrist sprain because it can present similarly to a lot of issues such as arthritis, tendinitis, and fractures. As a physical therapist, I'm going to once again take a nice subjective history, get an idea of what occurred when the pain started, how long the pain's been going on for. I'm going to palpate the area, I'm going to assess range of motion, strength. I'm going to test the integrity of the ligaments by performing assessments of the joints. It's important that if you're having severe pain in the wrist, especially if you can pinpoint a traumatic event like a fall or hearing that pop, it's important that you seek medical care very quickly because in cases of a fracture of the carpal bones, it can oftentimes involve the vasculature, the artery to that bone, and if that's disrupted, over time, the bone can become what we call necrotic, and then you have a much bigger issue on your hands. So once again, it's important to seek urgent care if you have severe pain in your wrist. So most of the time, wrist sprains can be treated very well conservatively. Only in severe cases of a grade 3 sprain may you require surgery to fix the issue. You're gonna typically be immobilized in a brace for as short as 1 to 3 days in minor cases, as long as 6 weeks if you require surgery. What that brace is going to do is keep the wrist stable and allow some healing to take place without movement disrupting the healing process of that ligament. Once you're out of the brace, we're going to start by making sure that we're maintaining the range of motion, that the wrist doesn't start to stiffen up or we lose range of motion in the different directions of the wrist. We're going to perform some gentle isometrics to begin strengthening and make sure the muscles do not atrophy or get weaker from disuse of the wrist. We're going to progress those exercises to include higher levels of resistance, more complex exercises. We're going to try to simulate or recreate what activities that you do in daily life. It might push it a little bit further if you're an athlete and require even more capacity out of that wrist. But like I said, this is typically treated very well through physical therapy or other exercise. Only in a grade 3 are you going to be looking at surgery typically. I hope you found the video helpful, and thank you for watching.